Good morning. I'm Lindsay Goldfarb, Healthcare Education Program Manager at Massachusetts Health and Hospital Association. And on behalf of MHA, welcome to today's Executive Insight Series webinar. MHA is excited to host this unique series, which features candid interviews of hospital leaders and will continue throughout 2021. Today's theme is A New System, A New Normal. A few logistics before we begin. We'll be recording this session for those who aren't able to join us, and all lines will be in listen-only mode. If you have any questions during the webinar, please type them into the chat box. The questions will come directly to us, and we'll do our best to address as many as we can during our time today. Following the webinar, we'll be sending out the webinar recording along with a brief survey. I'd like to take a moment to thank MHA's 2021 sponsors for their support in underwriting MHA's educational program. In particular, I'd like to thank today's program sponsor, Murphy Donahue Partners. A valued supporter of MHA, Murphy Donahue Partners offers comprehensive legislative services and effective marketing strategies for navigating today's complex political environment. Now I'll hand it over to Jack Murphy, co-founder and attorney from Murphy Donahue Partners, to say a few words. Jack, over to you.
Thank you, Lindsay. Murphy Donahue Partners is honored to sponsor this fifth session of the Executive Insight Series, A New System, A New Normal. Even with over 50 years of collective experience in the healthcare as attorneys and lobbyists, we believe that there is always something to learn in the healthcare field. So we are not only proud to sponsor this event, but excited to hear the presentation. Our moderator is Steve Walsh. In my many years of observing state government, Steve has and does stand out as a thinker and a leader in healthcare in the Commonwealth. Steve has assembled an impressive team at MHHA, and it has been a pleasure to working with them over the many years, over his tenure there. And I would like to, at this time, turn this over to Stephen Walsh, President and CEO of the MHHA.
Thank you very much. Thank you, Lindsay, for putting this on again, for all of the incredible work you're doing on behalf of MHA's education team. And Jack, thank you. Your team at Murphy Donahue has been our partners for many years, and you, Roger, Tara, Maureen, are longtime friends and supporters. Appreciate all of your partnership, support, collaboration over the years, and thanks for being here with us this morning. As those who have seen our previous episodes know, the goal of this series is to share some unique journeys, stories, perspectives, and personalities of our Massachusetts hospital leaders. Today, we are pleased to be able to catch up with the leader of one of our largest, but also one of our newest systems. Dr. Kevin Tabb is the president and CEO of Beth Israel Leahy Health. In this role, Dr. Tabb has been responsible for leading a comprehensive integration among BILH member organizations in their mission to provide better and broader access to care for patients and community members. As you might know, he was most recently the CEO of the Beth Israel Deaconess System and Beth Israel Deaconess Medical Center. But Dr. Tabb was raised in Berkeley, California, and emigrated to Israel at the age of 18, serving in the Israeli Defense Forces. He received his undergraduate degree from the Hebrew University in Jerusalem and his MD from the Hebrew University Hadassah Medical School. He is now one of the most prominent voices within our healthcare system. He is widely respected for his vision, his strong communication skills, and his ability to push the boundaries of how healthcare delivery works. We are thrilled to have him with us this morning, and as the Secretary of the MHA Board of Trustees, his voice has been especially crucial to our collective COVID-19 response since last March. Dr. Tabb, thanks for joining us and welcome.
Thank you, Steve. It's great to be here.
And to kick things off, as we just pointed out, you have been everywhere, from California to Israel in your career. How does our healthcare system here compare to the other ones you've worked with both nationally and internationally?
You know, it's interesting because I have worked in a variety of different places. I guess I'd call my career eclectic. So I've worked, I trained and worked in a different country, which has a really different system. I've worked in small startups in healthcare IT. I've worked in corporations. I've worked on the West Coast in provider organizations and here on the East. And each of those different environments, there are similarities between them, but there are also some major differences. I guess I'll start by saying came out to Boston 10 years ago. And for anybody that really cares about healthcare and wants to affect significant change, the Massachusetts market, the greater Boston area, this is the mecca for healthcare. I mean, people come from around the world, not just to get care here, but to train here, to practice here. There is no other place like it. It is interesting to see, having practiced in a very different system. Israel has a healthcare system that is similar to a number of countries in Europe, in that there is a universal healthcare, very different, obviously, than most of the places in this country. Massachusetts has something, I guess, close to that. But I'm frequently asked, what's the biggest difference between the healthcare system in Europe or Israel and the United States? And my answer to that is that the truth is that the biggest difference is that we, in this country, in the United States, we don't actually have an organized, cohesive, coherent healthcare system. And that's very different than any other first or second world country. So we have a host of different systems, but it's really left up to individual hospitals, healthcare systems, to make policy, to make decisions. And that has its own advantages, but also some disadvantages. And I think that's really the biggest difference, is that there's not a cohesive, coherent federal approach to healthcare in this country in the way that there is in most other countries.
So a lot of CEOs are hired to run systems. It happens every day across the country. It is rare, maybe a handful of times, right, where there's a leader of an inaugural system. So what are the first steps you took to ensure that both personally and professionally you were set up for success when you set out to create Beth Israel Leahy Health?
Yeah, it's ironic because I certainly didn't imagine 10 years ago when I came that we would be creating this new system and that I would be part of the team that runs it. As we brought Beth Israel Leahy Health together, and many people I'm sure in the audience know that it had, I guess, what I'd call a long gestation period. There were talks over many years. And as importantly, even when there was agreement between the parties that this made sense and we needed to do it, it required regulatory approval. And in this state particularly, regulatory approval is a lengthy process. And I frequently called this whole process sort of akin to, we were dating for many years. We decided we wanted to get married. We got engaged. We told our parents, meaning the regulatory bodies. And, this being Massachusetts, I guess there were lots and lots of parents. And it took some time. Ultimately, they gave us their blessing and we got married. But we didn't waste that time. If I had had my druthers, we would have gotten approval immediately and moved forward. In some ways, though, we were blessed to have that time, because that period of time between which we decided that we were going to move forward as a system and the date at which we actually were able to move forward was between 1.5 to 2 years. And we used that time intensively to prepare for the day that we would go live. Lots of discussion and planning and putting in place all of the structures and metrics and other things that we needed. I've been part of a large number of mergers and acquisitions over the years, particularly when I worked at GE and other places. These are never things that go the way that you think they're going to go. But it does help to have taken the time to plan, to have a roadmap, and then be able to execute on it when you go live. So again, ironically, I think in some ways we were blessed by having that period of time to think and plan.
And so that timeline created the environment where you were still fairly new when the pandemic began. Has the COVID-19 experience influenced the development of the organization, the integration of the organization? I think you had just almost moved into your new offices, and then here we were last March. How has the past 16 months changed the way you've developed the system?
Well, first of all, I guess I'd say the pandemic, the past 16 months, has changed every one of us, right? Has changed you and I and everybody on this Zoom call, I'm sure. I just talked a moment ago about the fact that it was great that we had all of that time to plan and we made all of these plans. There was nothing in our plans about planning for a pandemic, of course. And so you can put in place all of the plans you'd like, and then life hits you. And that, in fact, is what happened with COVID, with us and with everybody else. We were about a year into the merger when COVID hit. And what that meant is that we were really just getting started. We didn't have in place many of the, even structures, just regular formal structures and infrastructure that a typical mature system would have. For instance, we didn't have in place a system-wide emergency response structure. We didn't have a host of things like that. Ironically, coming out on the other side, as terrible as COVID has been, and it has been terrible for our providers, for patients and communities that have been hit, as a system, we come out stronger on the other side of COVID than we were going in. And I don't say that lightly. What we found was that the pandemic itself required of us to behave as a system much more quickly than we would have if we hadn't seen the pandemic. So that forced people to work together. That forced us to make decisions for the greater good that we always knew we were going to have to do, that it was the right thing to do. But we'd laid out plans that in some cases would take us 5 years or so. And as we come out of the pandemic, we've done some regrouping and sort of looking at where are we compared to what we laid out for our boards, for our organization, for the community, the promises that we made when we formed the system. And we've achieved about 80% of what we said we were going to achieve in the first 5 years. We did it in the first 2 years. And I said, notwithstanding the pandemic, and maybe that's not the right phrasing. Maybe it's actually in some ways because of the pandemic that we accelerated those things. There's a great story that I like to tell about the fact that one of the things we needed to do quickly was to organize almost a virtual single intensive care unit team across 12 hospitals, and the two leaders of the largest institutions quickly got together, organized that, and worked together intensively for 16 months. What they said at the end of the period was they described how well it went and how much they had become personal friends, and then they admitted they had never actually met in person, that all of this had occurred over Zoom, over phone calls. And so organizations find a way to make it work, and more than that, I think. And I'm particularly proud of the team that we have because there's a lot to be proud of.
Yeah, and we've done all sorts of deep dives on COVID and the response. And so I won't belabor the point, but I do want to pick up on one thing you said, because you were an instrumental leader outside your system. And I would say our relationship is more profound because of COVID. Yours probably with your colleague. Can you just spend a minute on the collaboration, the working together, the positives that came out as what's traditional, the Hatfields and the McCoys became all on the same team for this period of time? And that was kind of nice, wasn't it? I mean, it was kind of working together. We did some really incredible things. And I think all of you as CEOs led that effort. Can you just talk for a minute about that?
Yeah, I think you describe it really well. And I don't think anybody could actually overstate how important it was that we came together and how different that was than the way that, all of us sort of naturally work. I've said in other fora, certainly prior to the pandemic, that as it relates to healthcare, sometimes Massachusetts, the greater Boston area, can be what I call a tough neighborhood. Meaning, one of the things I mentioned that Massachusetts is the mecca for healthcare. Everybody comes here. There's a wealth of great institutions and incredibly smart people. That's a wonderful thing. Of course, it also results in a lot of competition. Really, the day that the pandemic, the weeks that the pandemic hit, that got wiped away. And all of us, the leaders of the different healthcare systems, under your leadership, together with you, we were literally on the phone with each other 3, 4, 5 times a day. And there was not a single instance that I can recall during the pandemic of competitive fighting about something. We were all trying to figure out, how do we make this work? And that meant everything from making sure that we had policies that were safe and worked, to transferring patients between each other, transferring equipment and PPE and other things seamlessly. We're coming out of the pandemic. I don't want to, I guess, knock on wood, the variant's still out there, and we're not completely out of the woods, but we're certainly coming out of it, and going back to the business at hand, so to speak, taking care of all of the other patients that need to be taken care of. I think the natural competition that has existed is still in place, but we have developed deep relationships, important ones, and understood and learned how important it is to work together. And I think that will serve us well in the future.
Yeah, that's a great way to put it. And I hope that you are right in that. And you mentioned you're pivoting away now. Obviously, you're focused on vaccinations and variants and some of the real sick people you have within your facilities. But at a system level, what's next for BILH now that you're able to focus on a few things other than COVID-19?
Yeah, we're thinking a lot about that. So some of it is simply what I would call the recovery efforts. And that means shifting gears from thinking about really COVID to the exclusion of everything else, to how do we make sure that we're able to accommodate the wave of other types of patients that need us. That's part of it, part of what the thing we're thinking about. Another piece that we're thinking a lot about, and I know we're not unique in this, is this issue of resiliency in our workforce. And we can't talk about COVID and the pandemic and the effect that it's had on all of us and the financial impacts and all of that without acknowledging how hard it has been for our providers. And, I think we have many people who come out of this, people have used the words burnt out. I'm not sure that's the right phrase. I mean, there are people that have come out of this really traumatized in some ways. And we have got to figure out how not to forget that. That is not going to go away easily. How to work with people as we come into the next phase. We're seeing a wave of retirements, everything from frontline caregivers to physicians to senior executives, and we're sort of dealing with that. This is an unprecedented wave of retirements around the country, I think, in healthcare that we're seeing, certainly within our own system. So we're dealing with that. And then thirdly, we're turning our attention again to focusing on the strategy of our system overall. And I think about the strategy that we take in 3 distinct phases. The first is prior to the merger. Really, a lot of our legacy strategies was about growth and bringing in new hospitals and providers, and that was fine. The second phase of the strategy really was about, as we came together, the integration strategy. Making sure that we achieved all of the benefits of integrating that one gets. And we've, as I mentioned, I think we've done very well there. We're not done. But it's time to turn our attention to the third phase, which is really about who do we want to be and what are the things we need to put in place to make sure that we will be that system to the people we serve for the next 15, 20, 30 years. And one of the things that I ask myself a lot is, and I get asked, how are we going to measure whether or not this merger was successful? And there are a lot of different ways and 100 different metrics that we look at, and of course, financial metrics and volume metrics and other things. But the thing that I think is that I remind our own organization of is that the single most important thing, the way that we will know that this merger was successful is if our patients tell us that we have made a difference in their lives. And I really feel very strongly that we need to be asking people what it is that makes a difference in their lives and focus on those things. And when we do, all of those other metrics will figure themselves out.
So I listened to your 3 points, and 1 and 3, I have the utmost confidence in you and your team to be able to achieve them, and we're betting on you. 2 is a little less about you, right? So just to follow up on 2, at the macro level, do those pipeline issues for workforce worry you with all those retirements just across the country? What do you see happening in the next few years?
They absolutely worry me, and there's a lot of talk about this because the effect, and what we're seeing is that very seasoned caregivers are saying, I'm done. I'm ready for retirement. It's not that they're going to work somewhere else, that they're exiting the workforce. We can, quote unquote, replace, in other words, hire new people, but it's very hard to replace the experience that retires when those people who are most seasoned retire. And we're going to have to figure out what that means. Some of it is bringing in new people, but some of it is doing things in a different way, organizing ourselves differently, and thinking about different types of people that will provide services. This is going to force our hand. Maybe that's not a bad thing.
Yeah. Well, I'm certainly glad that you're thinking about it with your colleagues. Turning to you just for a minute, you're practicing medicine and then leading this major organization can be seen as 2 very different things. I mean, what's your style? How has your training as a doctor shaped your leadership style to be able to bridge those 2 worlds?
Well, they are different things. There, of course, there's a connection. I don't think that it is a requirement that the CEO of a hospital or healthcare system be a physician, but I think in some cases it helps. The skill sets, though, are somewhat different. And I will never forget sort of coming into the role of CEO, never having been a CEO before, making a fair number of mistakes by falling back on behaviors and practices that served me well as an individual physician, but don't necessarily serve you well as a leader. And I think one of the major differences is as a physician, you're trained to fix things and to, in the old school, at least, to work as a silo. Of course, now we know that quality and good care is dependent on teamwork, even, down to the local clinical level. That's certainly true at the leadership level. And the most important thing that a leader can do is to surround herself or himself with people who are much, much better than they are at almost everything that needs to be done. I frequently say we have 36,000 employees, and 35,999 of them know how to do most things that need to get done much better than me. And so that's really my philosophy.
And one of the reasons why I think you've been such a valued member at MHA is you're a forward-thinking person and you see things differently than a lot of our other leaders do. Is there anything that we're not thinking about or we're not reading in the paper that you're thinking about in terms of the future of healthcare?
Well, I don't know. I think there are actually a lot of really good leaders in Massachusetts, and I'm tremendously impressed by the quality of the cadre of leaders in this state. I think for all of us, if there's any lesson that we need to take away from the pandemic, it's that we need to be prepared for the unexpected. And it's fine and important to lay out plans for all of the things that we know are going to happen. But it is at least as important to create a system that's resilient, able to shift, able to change, able to accommodate those are things that we may not expect now. And that's something that we've not always done, but certainly need to do.
One topic that I've heard you talk about that certainly is coming up, and as we look to the future, and we're all thinking about health equity differently. You just hired a new chief of DE&I. Can you just talk a little bit about your strategy at BILH?
Yeah, well, first of all, I'd say I'm very excited about the new Chief Diversity, Equity, and Inclusion Officer reporting directly to me that started a week ago at Beth Leahy Health. Juan LaPera, who comes to us from the payer world, actually, but comes with a wealth of experience in working with communities of color, with experience in healthcare from a different side of it. We've laid out a pretty comprehensive plan for focusing on the change that needs to occur within our own organization and that needs to occur externally. As it relates to the Chief Diversity, Equity, and Inclusion Officer, I'll say it's I was a little bit hesitant, and the reason that I was hesitant was that what I did not want to occur was to have somebody come and have the rest of the team or the rest of the organization wash their hands of responsibility and say, this is now somebody else's problem. And so it's really important to make clear, as great as a Chief Diversity, Equity, and Inclusion Officer is, this cannot end up resulting in the rest of the organization handing off the responsibility for equity and other things to one person. This has to be all of our responsibility. He's here to help us make sure that this happens.
Yeah, that's great. And thank you for your leadership there. We'll get into the lightning round here as we come up on time. A couple of questions about kind of the BILH integration strategy as you look at reducing redundancies, integrated electronic records. Is that working among all your locations and facilities?
Well, I'd say there's still work to be done.
Yeah.
We have about half of our system on a single electronic health record and the other half on a variety of different systems. And that's been a question that we've been asked from the very day that we talked about this merger. It's clear to me, two things are clear to me. One is, ultimately, you cannot have an integrated healthcare system on anything other than a single integrated record. And so we will get to that point. But it's also clear to me that the single worst time to rip everything out and put it in a new system is, the first year or two that you're merging. And so it's in the plan, but deliberately sort of spaced out over time.
Yeah, and during a global pandemic. We'll put that in a five-year plan.
Exactly.
Last question, because there's a lot of emerging leaders on our webinars. What's a piece of advice you can give them? They're trying to navigate their healthcare journey.
Yeah.
What's something that's been helpful to you that you can share with our audience?
Well, I guess I've done a lot of different things. I've been a practicing physician. I've worked in small startups. I've worked in large corporations. I've been a chief medical officer. I've been in IT, a CIO, a host of different things. And I frequently get asked the question, how do I plan my career to be a CEO or a CIO or whatever it is that, and my answer, first of all, is I have no clue, because I did not plan my career to do any of those things. But if there's anything that I could recommend to people, it would be try a host of different experiences, even if they appear off track. It's actually the diversity of experiences in different roles in different places that make up your entirety of experience, and having and being willing and open to try different types of things is ultimately, I think, what makes for better leaders.
Well, Dr. Tabb, certainly the time flies when you're giving us such rich content. I want to thank you for spending the morning coffee with us here, sharing some of your insights, some of your personal stories, as well as professional accomplishments with members of our team. As we come to the end of our time, thank you again. Thank you for your service on behalf of the entire healthcare community, and most importantly, our patients. Your leadership continues to change lives and improve dozens of communities that BILH serves. Thanks again to Murphy Donahue, partners, and all our sponsors, and most importantly to all of you, our attendees, who make this possible, for being part of, again, our 5th Executive Insights series. MHA offers programs like this every week of the year. We encourage you to visit our website for more information. And join us for our next Executive Insight session on July 15th, when we'll be joined by Deb Wilson, President and CEO of Lawrence General Hospital. And we encourage you to mark your calendars for MHA's Top of Mind Conference on Tuesday, July 13th from 9 to 11 a.m. We know that behavioral health has emerged as the epidemic within the pandemic, and this will be an opportunity to explore some of the most meaningful ways that we can improve our mental health system for every patient in need. Thanks again for spending your morning with us, and have a great day.